The planning screen optimizes how we customize the plan basis the patient. So it is very easy, as we have seen it, Dr. Vaidya operating. And getting the flexion and extension gap equal is the motto. Execution is extremely precise and accurate. And what you plan will get executed. Saw-based system, which has natural control. Highly adaptive camera adjusts the saw blade angle to earlier planned. Robotic arm adjusts real time to leg movement. Perfectly balanced knee, this is the pre-op, this is the post-op. Optimization in VELYS, no change in my OT protocols and no additional people required. CT scan is not required, my patients are price conscious, so no additional burden on them. I change the planning on the basis of the patient anatomy. The VELYS allows me to go beyond my current thought process. 95% of the times in my VELYS surgeries, I don't release any soft tissues. The key reason of my satisfaction is that I have not changed my operating style. What's special about VELYS? Next generation robotic assisted surgery, imageless, quick, small, more portable, excellent accuracy, provides tremendous intra-op information to surgeon on soft tissue balance, implant placement and limb alignment. And what is different about VELYS? No need of pre-op CT scan, no need for additional personnel in the OR. Planning screens are excellent. Ability to assess on the fly intra-op decisions and reflected soft tissue balance throughout the flexion arc is the key. Hydrophobic arrays with fewer lines of sight issues. The same flow of knee 3 computer navigation is continued, hence very user-friendly. Speed of registration is fast. Accuracy of plan, saw driven by the surgeon, a true participant rather than a bystander. And blade is 2 mm thick, so very accurate cuts. Overall, much pleased with this technology. VELYS RAS encouraged me to do the things I would not have done with my conventional instruments. Very happy with the how little soft tissue work needed. Almost time neutral on a short learning curve. Very accurate bony cuts and soft tissue balance. Planning screens are excellent and I have a wide variety of implant orientation. Because of optimization due to VELYS, quality and latest technology is available for the patients at the taluka level at an affordable cost. So this is intra-op photos. And everybody is happy with the final result. Thank you.